I was the second person in North America doing Botox. I got called to see the most amazing celebrities. I got asked to see Tina Turner, but I've also seen royalty. If you have Botox, you can actually prevent wrinkles. There is research that shows when you put fillers in, it stimulates your own body to make more collagen.
When you look at Michael Jackson, what happened there where your skin goes white?
Maybe he had vitiligo, which is an autoimmune disease where the pigment is destroyed. Eczema is a problem with the skin barrier. I'm not a big fan of steroids. Those are not so good for eczema. People use them for a bug bite or something.
I feel really, ugh. Thank you so much for your time today, Deborah. I really appreciate it. I think how I first came across your content, me and my team, since I've always grew up with eczema, like I wanted to talk to some dermatologists, skin experts, and that's something I haven't had on my podcast, and hence I reached out to you. So thank you for your time today.
Ah, it's my pleasure. Very exciting to speak with you.
Deborah, I guess please give the audience a bit of like an intro on sort of who you are and sort of what you've been currently focused on, and then I guess we'll take it from there.
Okay. So I'm a board certified dermatologist in New York City, and I wrote a book called Skin Rules. And dermatology is something I've been focused on for many, many years. I did my training in San Francisco, part of my training, and then the rest of my training in New York City. So to be a dermatologist, you have to go to medical school, and then you do general medicine, and then you specialize in dermatology. So a lot of training.
Interesting. Right now, I saw a lot of your interviews how you sort of specialize a lot in sort of cosmetic, sort of
Yes.
skin and dermatology. Has that been your main focus, or did you start in medical sort of dermatology and switched over? What was that journey like?
So I have always been very aesthetically oriented.
Mm.
And when I started dermatology, it was really the beginning of cosmetic dermatology. So I've always done both.
Mm.
But I was the second person in North America doing Botox. So it was the very early days of Botox, and it was something I was very interested in. So I think I've pretty much always done both. And one of the reasons I became very interested in dermatology was because it's aesthetic, of course. There's the cosmetic aspect. You use your hands a lot, so you need good manual dexterity. So when I was young, I used to make jewelry. And also, you have to be a bit of Sherlock Holmes because you have to solve a lot of problems. People come with all sorts of unusual rashes. So there's a lot of combining many different skill sets, I would say.
Interesting. Being one of the first two people that got into Botox, like, did you end up working with any cool celebrities?
Yes. Yeah. Yeah, well, you can't say, of course, because there's patient confidentiality, but yes. So I think sometimes it was kind of funny because I'd get a call from a hotel and they'd say, "Can you see so and so?" And I actually was so young at the time that I thought maybe it wasn't a real call, like it wasn't really the celebrity. I didn't want to go to somebody's hotel room and it wasn't real. So I would have to call the hotel and say, "I just received a call to see this famous person. Are they really staying there in this room number?" Because I didn't want to go and, have something horrible happen. So I would take my assistant and I would go. Of course, it was a real call. So I think I was very fortunate because very early on, I got called to see the most amazing celebrities. And I was so young that sometimes I would go to movie sets and famous actresses would say to me, "Have you ever done this before?" And I'd say, "Oh, yes." And they didn't even mean, have I done the procedure? They wanted to know if I'd ever done any dermatology because I looked so young, because I was so young. I was in my 30s. So it was many, many years ago. And I think people were really shocked that I was the person when I showed up because I think I even looked younger than I was when I was in my, well, you look very young in your 30s. You are young. Yes.
Interesting. Any names of, I guess, maybe celebrities that maybe passed away that now the confidential?
Yes, I could tell you one that passed. Well, I could tell you two that passed away. How about that?
Yes.
So one, I was asked, and I think I was maybe 30 years old. I got asked to see Tina Turner.
Ooh.
And in her, yeah. And I was so shocked. That was the person that I thought maybe it wasn't real. And she was in her pajamas, yeah, in a hotel. And she was so lovely and so sweet. And I was really shocked because I really think I was maybe I was 30, 31 years old. So I was so young. Yeah. So you never know in my field who's going to walk in, who's going to call you. So I was very fortunate, I think, in my career because New York City, you really do see not only very famous people, but also you see the rarest of diseases come through your door. So you see the rarest things and you get to see the most famous people. And I've also seen, and I can't say who, but I've also seen royalty in my office. So that was also very strange that people would walk in with bodyguards and come by private jet and they were royalty and shocking. And sometimes people, this is also shocking, would be in the room with their personal physician because it was royalty and they wouldn't talk to me. They would talk to their physician and then the physician would talk to me. So that was very odd. So I've treated Nobel Prize winners, I've treated movie directors. Yeah, it's kind of been an unusual life. And I've treated a lot of very regular people as well, and all sorts of people for sure, all walks of life.
In your field of work, has it always been one to one where you really couldn't hire someone to take your place? You'd always have to be at the sort of medical center, and if you wanted to take a month off to go on a holiday, that was a month of work that was now no longer going to happen? Or did you find a way to find other employees and other dermatologists that could take your place?
So I've never had another dermatologist in my office, but I have had laser technicians and medical assistants and people who've really supported me and have been incredible support. So I think who works with you makes such a difference. So I have an assistant, my assistants have been just so invaluable. And it would have been very hard to do what I do. Like last Christmas, I took a month to Australia. So, because to go to Australia, you can't go for the weekend. It's a very long trip, especially Western Australia. So, we went for a month and my staff held down the fort. Now, they don't do the Botox injections, they don't do the filler injections, but they can do lasers. There are some things that they can do, and they do for me. And we were in touch daily through email. I spoke to them, but they did a great job.
Interesting. When it comes to like the cosmetic industry, um, is America ahead, or are there countries like Korea that are a few years ahead over the last 30 years? Or what's your thoughts on other countries in that space?
Well, interestingly, for Botox, there were people in London doing Botox. I feel like at the time we were doing Botox in the US. So England and the US were at the beginning of Botox. I think Korea is known for skincare, for products, but I think the US is pretty much cutting edge for the lasers, the fillers. Sometimes the US is slower to give FDA approval for the fillers, but I think rightly so because they want to make sure that they're safe, and I think that's okay. But I think the US is pretty way ahead in terms of a lot of the technologies.
When it comes to like Botox and fillers, are there side effects? Like, are there any consequences of what you might look like at an older age if you've done that at an earlier age, or not really?
So it's interesting. There are twin studies where one twin had the Botox and the other twin didn't. And the twin with the Botox looked better. So the reason that Botox makes you look better, and they talk a lot about preventative Botox, is think about this. If you have Botox, you're not allowing the muscles to contract and crunch on your skin and make wrinkles. So you can actually prevent wrinkles. So if you don't want wrinkles, then you're better off doing Botox. So I always tell my patients, if you're going to care about wrinkles, then do Botox. If you don't care, you don't have to do Botox. But if wrinkles are something that bother you, then you should do Botox early on. And so we have patients now who do Botox at 25, 30, so they never get the wrinkles, because those wrinkles are dynamic wrinkles, wrinkles when you move. Once the wrinkles have set into your skin and they're wrinkles at rest, Botox will not take care of them. And then you have to fill those wrinkles with filler. So then you need two procedures. You need Botox, and then you need a dermal filler to actually fill the wrinkles. So you're way ahead of the game if you've done Botox and maintained your skin, and then you don't need to have filler.
Interesting. Prior to the existence of sunscreen, did people die of skin cancer?
Well, people still die of skin cancer. As you know, in Australia, you have such strong sun. I remember when I went to Australia for the first time, I was kind of shocked at how strong the sun was. And I think that the incidence of melanoma keeps going up because people still go in the sun. People don't always use their sunscreen. You know, sunscreen wears off, you go in the water, you don't reapply it, you towel off. So it's complicated. So yes, even if you wear your sunscreen, if you're not perfect with sunscreen, you can still get a melanoma, you can still get skin cancer, but it certainly prevents a lot of skin cancers. And then, of course, some people are unlucky and they have genetic skin cancers as well.
Got it, I see. Deborah, when you look at like celebrities, could you tell instantly if they've gotten fillers? Like for example, one of the like big samples is like Kylie Jenner. Everyone's like, it looks obvious, but then she's not claiming it. Like from your perspective, do you instantly know?
Yeah, we know. I mean, I could, you want to know something funny? When my daughter was little and we used to play Scrabble, she wanted to use the word Botox in Scrabble. And it's just funny because she could look at somebody and know that they had Botox, and she was little because she had a trained eye for Botox. Yeah, if I have a trained eye, I could look at somebody and I know if they've had surgery, I know if they've had Botox, I know if they've had filler, but that's what I do for a living. So yes, I would know, but it also depends, of course, on how well your eye is trained and also how well is the injector injecting. So I could inject somebody with Botox that's very subtle, so I won't totally eradicate their frown, and I could soften their frown so they could, let's say, be an actress in a movie and they could still frown. So that's really subtle, good Botox. Or I could totally obliterate their frown and then they have no movement. And then everyone's going to know that they had Botox because the natural face will frown. So it depends what you're trying to accomplish. And that's why it's very important, if you're having Botox or filler or whatever you're doing, to have a very detailed discussion with your dermatologist, plastic surgeon, or whoever is the injector, to make certain that you get the desired result.
Within the movie industry, you hear a lot of stories of actors having to get ripped and getting six packs for like new superhero roles, and that basically, since the time frame is so short, they're pushed to do like steroids and really accelerate that process.
Yes.
Has the same thing applied when comes to like females having to get Botox to look a certain way for movies? Is that a thing?
Well, interestingly, a lot of my actress patients don't do Botox right before the film because they want to have facial expression. So I think it's a little bit the opposite for an actress versus a model. So if I have a model, they might want full face Botox because they want more of no expression and they want no lines. Whereas a lot of my patients who are actresses, let's say you're going to be in a movie about World War II, you have to frown. It would look ridiculous if you didn't frown during that movie. And of course, there was no Botox during that time period. So that's a problem, you know. So for many of our patients, we do a washout period for their Botox. We figure out when they're filming, and we do not put Botox in when they're filming. And then when they finish the film, then we go back to doing Botox.
Got it. So Botox is a chemical that relaxes that muscle, whereas fillers is you're
Yes.
putting in something that fills up that place to make it look more full.
Exactly. So, but you could have fine lines. Let's say you have fine lines around your lips or you have crow's feet fine lines. We could use very fine line filler that doesn't give you much volume, but it fills the fine lines. So, let's say you're somebody with deep frown lines and now you want to be in a movie, but you don't want those deep frown lines. So, I could fill your deep frown lines with very fine line filler, not put Botox in, make you look better for the movie. I won't do your Botox. I'll just do fine line filler for the frown lines. And then after the movie, I will continue your Botox. So that's why you need to have a lot of tricks up your sleeve as a dermatologist so you can accommodate a patient who is acting. That's why a lot of people come to me, because they need to be able to do this. Many dermatologists just do Botox in the frown lines, and they don't attempt to put fine line filler in the frown lines. So they wouldn't be able to do that. So whenever I offer that to patients, they're always shocked because they didn't know that they could have fine line filler in their frown lines.
With the fillers, what is it made out of? And then how deep underneath the skin do you sort of fill it in? And how long will it last in there?
So fine line fillers, the ones that I use, are made of hyaluronic acid. Our skin is made of collagen, elastic tissue, and hyaluronic acid. So the hyaluronic acid that I put in the skin is identical to the hyaluronic acid that is in your skin or my skin. So nobody would know the difference. And that's why I like it, because it's totally natural. Let's say I put it into your skin and you said to me, Debra, I don't like my filler. I could dissolve it within a few minutes. So there's a dissolver for hyaluronic acid. And that's why all the fillers that I use are totally natural and totally dissolvable. There are fillers on the market that are not, but we don't use them in my office because we want people to have the option to dissolve the filler if they don't like it. So, you know, that's something that you also would want to discuss with your injector to make sure that it is a dissolvable filler. I think it's safer that way. How long does it last? It depends. If you're putting in a filler with Botox, the Botox protects the filler, let's say in the frown area, so it doesn't allow the muscles to crunch on the filler and break down the filler. So the filler will last longer. So if I do Botox and filler in a frown, it'll probably last 6 months or longer. If somebody doesn't want the Botox and they just want filler, it's going to last for a shorter period of time because those strong frown muscles will break down the filler in the frown.
That's amazing. So basically, do you have like this basically subscription model where clients have to they keep coming back again and again every 6 months to sort of top things up, get it back to what it looked like? And then you basically, do you have clients that you've worked for 20 years?
Yes, yes. Yeah, we look it up sometimes. Like we were just looking. Yeah, we have some of the, you know, some people move, some people change, but we have many patients that have been there for 20 years. It's hard to believe how the time passes. We have patients that have been with me since the beginning, like 30 years. Yeah. Yeah.
So I understand how you said that Botox is a preventative because it's basically just a chemical that relaxes your muscles. What about fillers?
Yeah.
Like, does fillers like expand your skin? Does it lead to sagging when you're older of the skin? Are there any consequences of using fillers? Do they do a twin study for that?
So fillers are very interesting. There is research that shows when you put fillers in, it stimulates your own body to make more collagen. So
Mm.
there are times where I've put in fillers. Let's say, for example, somebody has a depression in their nose because they had a skin cancer in their nose, and the surgeon made a depression from taking out the skin cancer. Sometimes I put filler in, filled it up, and 7 years later, the filler appears to still be there, right? Because the depression is gone, but that can't be because filler doesn't last 7 years. So then we see that that filler stimulated their collagen and it stayed for 7 years. So sometimes you can get miraculous results like that. And I've actually seen that. I have documentation, I have the photographs, I have the dates, I have the charting. So you can see something like that. So it depends on the location of the filler. Let's say you put filler in the smile lines, but you're smiling all day long. That filler will probably break down in 6 months and it'll have to be repeated. So it really depends on the location of the filler. But filler doesn't lead to sagging. It just stimulates your own body's collagen, or maybe you're somebody where you don't have good collagen and it doesn't stimulate it. So it lasts 6, 8 months, a year, and then it has to be repeated.
Okay. So if there's like two different people, one person A used a lot of fillers, a lot of Botox in the early 20s, but from when they turned 35 to 60, they stopped using it and now they're 60 years old, versus a person who's 60 and's never done Botox, never done filler. Could you tell the difference between these two 60-year-olds?
And when did they stop using the Botox? At what age?
35?
Well, maybe by 60, maybe not. Maybe we wouldn't know the difference because so many years, 25 years have now passed. Maybe not. Maybe yes, maybe no. Hard to know. I wouldn't know. I don't want to say. Maybe the Botox one, maybe it would also have to do with how much sunscreen they used, how well they took care of their skin. But, that's a lot of years of nothing. You know what I'm saying? By then, maybe they would have caught up and they'd look about the same.
Okay, interesting. Tell me about your book that you wrote, Deborah. What motivated that? Like, that seems like a cool, interesting fork in the journey. Yeah.
Why did I write a book? Well, I'm always interviewed by newspapers, magazines, and I thought it would be fun to write a book. And I wanted to write a book that was very, very simple. So I wrote a book called Skin Rules, Trades. It's called Skin Rules, Trade Secrets from a Top New York Dermatologist. But what I thought was interesting about it was I wrote the book by hand. I didn't type it. I didn't write it on a computer, just hand wrote it in a book. But then I decided, because I looked at everybody and I thought people are in a rush. People don't have a lot of time to read. So I kept making the book shorter and shorter and shorter. And the book was a book of rules, like how to wash your face, what products to pick, and what procedures can you do. So I tried to make it the shortest possible book of rules that I could so people would actually read the book. So what I thought was funny when I was reading but I spent a lot of time, you understand, I spent a year writing the book. And then when I gave it to the publisher, they said to me, first they said, do you have an outline of the book? And I said, I don't really have an outline. I have a book. Could you read the book? They said, we don't read a book. We read the outline. So I had to then write an outline. The outline was almost as long as the book. The book, I told you, was very short rules. So they bought the book. I only gave it to one publisher. They bought the book. So I kind of did everything backwards. Then they said, you need an agent. So then I already sold the book and then I got an agent. So I did everything absolutely backwards. So then sometimes people would write, some people, of course, love the book. And then some people wrote, the book was too short. And I thought that was kind of funny because I spent a year making the book shorter, 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 right? I wrote a long book and then I made it very short and very, very concise. So, because I know nobody in New York has any but time, because I realized from my practice, people would come in and they'd say, like, can you give me Botox in the shortest possible time? Can you do this? I'm in a rush. I have to make a train. I have to make a plane. I have to be here. I'm on a Zoom. I have a call. I have a meeting, right? So I think that I accomplished a lot in a short amount of words. Very, very concise book. And I just wanted to tell people what I really gathered, learned after so many years of dermatology, whether it was how to take care of a wound or how to wash your face, or how to take care of your skin, or how to pick a sunscreen. So I just gave people the most important things that I learned after so many years of dermatology in a short, concise book.
Interesting. Yeah, I was just gonna ask, like, if so, went over, like, you'll probably go over everything from how to get clearer skin, how to get lighter skin, how to
Yes.
get less wrinkles, how to get no pimples. I guess one thing that
Yes.
questions me, when you have a cut from falling down, what's the best way to heal it without scarring?
So the best way to heal a cut, and most people don't know this, is to clean it. Most people clean it with hydrogen peroxide, but the research shows, and there's a lot of research on this, that it's better to clean it with rubbing alcohol, and then you want to keep the cut moist. And you can keep it moist with Aquaphor, with Vaseline, with antibiotic ointment, but it has to stay moist because the skin cells need to slide across to heal the wound. And then you want to keep it covered. Good to keep it covered with a waterproof bandage. And then you want to keep it covered till it's totally healed. See, a lot of people think that the wound has to dry out and they want a scab, but you don't want a scab. You want a wound that's very moist.
Interesting. How about when someone like me who has eczema, where there's certain areas that might be darker due to constant itching? Is there anything I can do about these dark patches in my skin, or is it too late?
Now, dark patches can be treated. So, one thing you always want to do is wear a zinc based sunscreen, especially in Australia where the sun is so strong, because that's one of the reasons it's getting darker. And then there are products that you can use to lighten the dark discoloration, like there are products with azelaic acid, which you can get over the counter. And azelaic acid helps to lighten the skin without irritating the eczema, because a lot of the products that would lighten the skin that we use are irritating to eczema. So you don't want to irritate your eczema.
What is eczema? Like, did eczema always exist back in the medieval ages? Or is it a
Yeah,
recent thing?
I
Is it?
think so.
Okay.
I don't think it's recent. I think so. Eczema is a problem with the skin barrier. So I understand you have it and I have it too. And I've had it since I was a child. And people who have eczema don't have very good barrier protection to their skin. The skin tends to dry out very easily and it's very sensitive skin. So you have to treat your skin like it's very delicate. So, for example, when you take a shower, you want to take the shortest shower you can and you want to use warm water. You don't want to use steaming hot water because the steaming hot water takes all the essential oils out of the skin and makes it drier. You want to use soap that's like a body, uh, not like a body gel, but like one of the body washes that's fragrance free and super hydrating. So, here we use things like Dove unscented. I don't know what you have in Australia exactly, but you want to use the mildest, gentlest cleanser that won't strip your skin of its natural oils. That's really important because here we have very caustic cleansers and fragrance cleansers that really strip the skin. The other thing is, you always want to put a moisturizer on that's fragrance free after you get out of the shower to reseal your skin. You want to use a humidifier if you're indoors and it's heated indoors, because that indoor heat will dry out your skin. And you also want to use an air purifier. That's very important. Air conditioning, we have a lot of air conditioning in the US, is very bad for the skin. It really dries out the skin. And then the fabrics that you use on your skin, like you want to use cotton and natural fibers. You don't want to use mohair or wools, which maybe you don't use that much of it in Australia. The other thing is when you wash your clothes, you don't want to use fabric softener. There's fabric balls, and the detergent you use, you want to make sure it's unscented, very pure detergent. So you don't put detergent that's going to be irritating to your skin on your skin. So there are a lot of things you can do that will help eczema, and a lot of it's preventative. So you don't get the eczema to begin with.
With eczema, is it just people feeling that itching sensation? Like theoretically, let's say someone had extreme eczema and you wrapped up their fingers and nails where they couldn't scratch. Would they have clear skin?
No, they definitely have a problem with their skin, and a lot of times you need to treat it. I mean, sometimes you need to use prescription strength creams for eczema because they really is a problem with their skin surface. But a lot of my patients with eczema, when we change their habits, their skin doesn't itch as much, you know. We really spend a lot of time teaching them how to change what they're doing so they're not as itchy. But it takes time. It's not instant. It's like a whole process of spending time with the patients. And some people, of course, have food allergies. So you want to make certain that it's not something you're eating that's triggering the itching.
Got it. So when like I get prescribed steroids such as mometasone or beta
Mhm.
methasone, do these steroids just stop the itching or do they actually change the skin in some way? What do they do?
I'm not a big fan of steroids for eczema. We use other medications. I'm sure you have them in Australia. In the US, they're called like Elidel and Protopic. So I can email you the names and the generic names. You would be better off asking your dermatologist not to give you topical steroids and to give you other medications that actually get to the root of the eczema and they don't just stop the itching. You know, those are not so good for eczema.
Interesting. Tell me about that. Like, what do you mean by get to the root of the eczema? Like, what is the root of the
Well,
eczema?
they actually stop the inflammation. They're anti-inflammatory medications.
Mm.
Yes, steroids aren't very good for your skin. It's not the way to go. We rarely, I mean, dermatologists in the US may use them, but in my practice, we use it maybe for a week or so in desperation if we have to, but I try not to use them. I try to actually use other topical medications.
Got it. And I remember being the last time I went to the dermatologist, he talked to me about UV therapy, about standing in this thing and it had all these lights.
No, I wouldn't do that either because you're going to get skin cancer.
Okay.
That, yeah, don't do that either. But I'm happy to, I can send you a list of all the newest technologies. I'm sure Australia is very modern with their medications and with their treatments. I'm sure you have it in Australia. You just haven't found the right doctor.
Got it. I see. Interesting. So, like, I was gonna ask, like, what causes that itching sensation from eczema? So I guess it's just due to irritants such
It's
as.
inflammation and eczema is genetic. It's not your fault. Somebody in your family, if it wasn't your parents, it's your grandparents, it's somewhere in your genes, you know?
One thing that I found common is that a lot of like Vietnamese people in Australia have eczema, and in my mind, like when I went to Vietnam when I was younger, my eczema would sort of flare down, and I don't know if it's because it's a more humid climate, more
Yeah,
tropical,
well,
and
that
then
makes sense. Yeah, that makes total sense. Humidity is good for, yeah, could be because like New York isn't in the winter is a killer for eczema because it's so dry and cold.
and what about diet? Is there any correlation between inflammation, eczema with diet?
Well, that's what I'm saying. You could have food allergies, and that's why a lot of people with eczema get tested to see if they do have any food allergies.
Got it. Okay. How about cold baths? Is that something that's good for the skin? I force myself to have a cold shower each night thinking it might help my skin. Is there any studies there?
Yeah, so that's what I'm saying. It's better to take cool or warm, not hot showers. Hot showers are the worst for eczema.
Okay. And with the book you wrote, Deborah, with all these different rules, such as probably moisturizing your skin and using sunscreen all the time, does it ever cause your skin to have dependency where if you're thrown in a scenario where you don't have access to moisturizer or sunscreen, your body might overcorrect it and flare up, or there isn't any dependency?
No, it's not like drugs. It's not like becoming drug dependent. No, skin is very different. Yeah.
Got it. Okay. Another question I had was when you look at Michael Jackson, what happened there? Was it a medical issue where he had the issue of I think it's a type of medical issue where your skin goes white, or was it a cosmetic change going fully white? Like what happened there from your
Well, you know, I never saw him as a patient, but it seems like maybe he had vitiligo, which is an autoimmune disease where the pigment is destroyed.
And then do you think he tried to match it and have it all go white using, and how could you do that? Like what type of treatment can you sort of match the autoimmune disease with?
Well, there are medications that can destroy the pigment.
Mm.
So to make all your skin more one color. So it's possible that he did that.
Do you think it was more of like a cosmetic decision or like a medical decision?
You know, he was very cosmetically oriented as he had so much plastic surgery. So maybe it was a cosmetic decision, but it's always hard to know. He's not here for us to ask him. So hard to really know.
Got it. Is dark skin bad? Like I naturally absorb the sun, so my skin is much darker. I know in a lot of Asian countries, having fairer skin is something that is more sought after. Does like if I am darker, does it mean I have a higher likelihood of getting skin cancer or anything or
No,
what's
it's the opposite. It's the opposite. So if you have darker skin, you have less of a chance of getting skin cancer.
Alright. Awesome, Deborah. Yeah, thank you so much for your time today. The two last questions I usually wrap up these podcast interviews with is one, any recent discoveries that you've been implementing to your day-to-day life?
Well, for my day-to-day life, I think the most important thing is a healthy diet. You know, I try to eat a lot of, and I think it's very healthy for your skin. So I would say eat a lot of antioxidant rich foods. You know, I try to eat all the colors of the rainbow in my fruits and vegetables. I eat a lot of avocados, blueberries, just try to eat very healthy. And I try to walk every day. I have a dog, which you probably heard earlier when somebody was trying to come in. And so I walk my dog 3 miles every day, and I do try to eat healthy. And I think that's very important for the skin.
Interesting. Another quick thing I'd like to do is I prepared this mini slideshow of a rash that was on my back and how it sort of progressed over the last 2 3 years, and I'd love to get your thoughts live on this
Sure.
podcast. I'm gonna share my screen and you can let me know if you can see it. So I'll find some more close-up photos. So this is sort of around September 2023, a year later, where the skin was quite clear. I was getting dots a bit everywhere, but I didn't think anything of it. And then, let's see, November 2023 was fine. Um, it started getting more dotty around maybe the beginning of this year, but I didn't think anything of it.
But
Um,
it's just discoloration. It doesn't have any. Oh, I see it now.
and then this is roughly around Jan of 2024, where it was itchy. You can see dry patches. And then I think it got even worse than this. Let's see if there's a worse photo. Okay, yeah, this is probably what it looked like.
But mostly what we see is discoloration, right? It's not, is it itchy or no?
Yes, it was very itchy.
And do you take any medication?
No medication,
Pills or no?
no pills.
And then it went away?
And then that was in February, and I've been recently using the steroid that I mentioned that stopped the itching. And this is sort of what it looks like today. So I guess
And
it
what did
looks
the dermatologist think?
we did a biopsy and it was confirmed eczema, and I'm gonna see him tomorrow, and I'll see what he says. But he's basically said, hey, it's eczema. Use a ton of this steroid because previously I wasn't using it, and that should halt things. And tomorrow, I guess we'll see what he says. And that was a month ago.
Wow. You've used it for
4 weeks.
uh-huh. Wow. So one of the creams you could use is tacrolimus. You've never had that?
I've not used that before. No, tacrolimus.
So there are these different ones called tacrolimus, picrolimus. Those are the ones that are not topical steroids, that have no side effects. And I'm sure they have them in Australia. Can't imagine.
And then, what's the difference between tacrolimus, picrolimus to, say, Elocon, betamethasone? Do they both do things differently? Is one stronger, and what is it stronger in?
No, no, no. So topical steroids, the problem is they have side effects. They thin your skin. Just a steroid. It doesn't really get to the root of the problem. That's what I was saying. So these decrease inflammation in the skin. So I'm going to write you an email when we're done, and I'll write the generic name so that it won't be the US brand name. So you
Yes.
can ask your dermatologist if they could give you any of those. There's a lot of them that we use. Some of them are harder to get than others, but they're like, I have one right here. I could hold it up. This one, I have it because I have eczema. This one is called ruxolitinib cream, right? See this?
Mm.
This one is probably one of the best eczema creams in the world, but it's hard to get. It's a little expensive in the US. But if you have health insurance there,
Yes.
if you could get this cream, it's like the most amazing technology.
Okay. Best eczema cream in the world.
I think this is I don't work for the company. I have no vested interest in it. But I'm telling you, it wasn't easy for me to get this in the US, right? Because in the US, we have the worst drug reimbursements. But I don't think in Australia you do. I don't think drugs are expensive, are they? Medications?
A lot of it is covered by the government, health
Yeah, I think so.
stuff.
We don't have that here. Here, everything's private, so we have to pay a fortune. So I was very fortunate that I could get that. But if you could get a cream like that, it's the most amazing technology. But there's other creams, even if you couldn't get that, that I can send you the names of. I'll make a list and send you all the names. And the other ones have been, this is newer, but still, I know they exist in Australia, and I'm sure you could get them. But do you go to a dermatologist or a generalist?
Um, I only saw the dermatologist recently, 1 month ago. That was the
Uh,
first time I've seen a dermatologist
uh,
since I was a
uh,
kid. So, like, I haven't seen a
mhm.
dermatologist since then. I've only went to a GP, a general practitioner.
Because I would think, like, even in the US, if you go to a GP, they would give you steroids, but I would think a dermatologist would give you the more advanced technologies for eczema, you know?
Interesting. So, all the cream that you
Yeah.
mentioned, like Terra, Limus, Pica,
Hmm.
are these
Hmm.
new creams and new
Are
sort of.
they new? No, not
Oh,
new. We've used them for years. They're not new, so I'm sure you have them.
interesting.
And you could use them in conjunction with steroids, but the problem with using steroids is when you use steroids, the eczema tends to come right back. It's not really solving the problem. It's just like a band-aid.
So,
Just afraid your eczema is going to come right back.
yeah, why do topical.
I don't want to criticize your dermatologist in Australia on the air. So I don't know why they did that. I have no idea what their experience is with this. I have a lot of it. You know, in life, some people probably treat a lot of one thing. I treat a lot of acne, a lot of eczema, a lot of cosmetic dermatology, a lot of moles. I don't treat a lot of other things, maybe, but I do treat a lot of eczema. Maybe because I have it. People come to me for it. I don't know. But we have a lot of experience with it. You have to use other medications. You can't just use steroids.
Why do topical steroids still exist, given that there's things that actually solve the
Well,
root?
they exist because people use them for a bug bite or something, or maybe for a week with eczema, but you can't use them. It's not the best choice to use them for 4 weeks, in my opinion. It's my opinion. I
Oh, no.
mean, but
I feel really, ugh. Interesting. And then now, Deborah, given that you have eczema and with all your expertise, what happens if you don't use that cream? Does eczema start flaring up? Does it?
mine, if I don't, this is why my cream is sitting by on my bedside.
Okay.
Yeah, I have to use it. Yeah.
So I guess there's no long-term solution that. Yeah, like it would.
No, it's your genetics. I mean, look, the better I am with doing all my preventative things, like for example, here, since we're sitting here in a bedroom, this is like, I'm not trying to, this, you see how it says advanced repair cream for very dry skin?
Yes.
So I always have to use creams for very dry skin. And the better I am with using cream for very dry skin, the better I will do, you know?
This is something that I've been doing, Deborah, where I use Soberlin like a moisturizer and then I put Vaseline on top. Is that a good?
That's fine. Yeah,
Okay.
that's fine. Just make sure if you use Vaseline, you use original Vaseline,
Yes.
because there's other Vaselines that have all kinds of additives in them that aren't good for your skin.
Got it. And my
It's
understand.
blue label. It says blue label original Vaseline.
Got it. And from my understanding, like Vaseline doesn't actually moisturize the skin, so I'd need to put a moisturizer underneath it, right?
Yeah, that's good. Yeah.
Okay, cool. And with what you saw with my back, like what happened there? Like how did it snowball? Is it a case of it snowballed, it started small and it got to a tipping point where it
Yeah.
exponentially grew?
Yeah, it got worse. And then because you're dark skinned, everywhere there was inflammation, it discolored your skin.
Got it. And for example,
Yeah.
after using that steroid, for the last 4 weeks, I have stopped itching my back. I haven't touched it, but
Yes.
the pigmentation is still there. Technically, could I stop using the steroid and maybe, but I think if I stop using it, the itching might come back.
Well, that's why I'm saying you need to go to one of these other creams.
Makes sense. Makes sense.
Yeah.
Okay, cool. Last question, Deborah, is what's your main focus and goal over the next 6 months?
Over the next 6 months, well, we are now redesigning our website. So I've been doing fast and furious, a lot of writing. So we're rewriting our website. We rephotographed our office last Friday. So we're just doing a lot of writing. So, because things keep changing in dermatology, lots of new technologies.
Any chance for a new book in the next 5 to 10 years?
I haven't thought about that really because I've been writing so much for this website, but who knows, maybe.
Deborah, where can people find more of you? How can they get more of Deborah?
So they can go to our website at Dr. Jaliman, JALIMAN.com.
Beautiful. Thank you, Doc. I really appreciate your time today. Yeah, this was a fun episode. I love how you're very blunt, straight to the point, very New York like. And yeah, this is a very fun. We talked about so many different random topics from cosmetics to eczema. And this is something that's definitely your expertise. I really loved those stories. You probably have so many cool stories in the vault.
Yeah.
But thank you so much for your time today. I had a blast.
Oh, Andy, it was great to talk to you. And if you ever have any questions about your eczema, feel free to email me, call me anytime.
Thank you, Deborah. Guys,
And I will send you that information about those medications.
I would love that. Thank you, Deborah. Thank you, guys. If you made it this far, please let me know your thoughts on this episode. And I'll see you guys next week on another episode of the podcast. Peace.